Mr. W. My name's Erin, and I'm a nurse practitioner student. I'm going to be evaluating you today before Dr. Pope comes in, okay?
Yeah.
All right, so you're a new patient here. How old are you?
I'm 30 years old.
Okay, so tell me what brings you into the office today.
Just a headache.
A headache?
Yeah.
Okay, so when did these headaches start?
I'd say about a month and a half ago.
Okay, describe the headache to me. What does it feel like?
Feels kind of like a dull pain. Kind of goes from one temple to the other. That's about it.
Okay, and how long do these headaches last?
Anywhere from 5 minutes to an hour sometimes.
Okay, how often do you get them?
I'd say 5 times a day.
5 times a day.
Mm-hmm.
Okay, and what would you rate the pain of that headache on a scale of 0 to 10, where 0 is no pain and 10 is the worst pain you've ever experienced?
The worst one I've ever had is probably around 6.
Okay, is there anything in particular that brings on this pain that you have?
Bright lights primarily do it. Other than that, maybe possibly stress.
Okay, and so bright lights and stress bring on the pain.
Mm-hmm.
And you said the pain is dull. Is there any other way you would describe that pain?
Dull is probably the only way I could describe it.
Okay, and it's always across your forehead, never worse on one side?
Yeah, sometimes it does go to my left side just a bit. Other than that, yeah.
Okay. Do you ever have any blurry vision or dizziness with this?
Blurred vision just a little bit. No dizziness, no.
Okay. Never passed out from it?
No.
Okay. Anyone in your family have these kind of headaches or any headache of any kind?
I'm sure they've had headaches, but none, I mean, I've been talking to my mom off and on about this, and she's never had anything like it. She doesn't know anybody else that has either.
Is there anything that helps to get rid of the headache?
Just to get away from the bright lights.
Okay. And do you take any medications?
I take Advil for the pain.
Okay. Any other medications?
Multivitamins in the morning.
Okay, and you take those every morning?
If I can remember to, then yeah, I do.
How often do you take the ibuprofen?
If my headaches are really bad, I'll take like 3 or 4 pills, so I'd say once a day.
Okay. And do you have any past medical history? Have you ever been to the doctor routinely for anything, or been told you've been diagnosed with anything, been to the hospital, had surgery?
No real past medical history. I mean, when I was a kid, I broke my arm twice. Other than that, I've had surgery on my hand.
Okay.
So
you went under anesthesia?
Yes, they did put me out.
Any complications from anesthesia?
No.
Okay. And tell me, you have any allergies to any medications, any foods, any environmental factors?
Just poison ivy, that's all I get. So.
Okay. You told me about your medications.
Mm-hmm.
So tell me about your family. Mother and father, are they still alive?
Yes, they are.
Okay. How old are they?
My mom's 55, my dad's probably 55.
Okay. And do they have any past medical history?
No.
And do you have any siblings?
I do have one older sister.
And how old is she?
I'm 30, so she's 33.
Does she have any past medical history?
No.
Okay. And then tell me about, what do you do for a living?
I work at a federal building, clerical work. I just started about 6 months ago.
Okay. Is it very stressful?
Learning a new job is, yeah, I mean, that takes a toll.
Okay. Are you married?
I am married.
Okay. And just to go back about your job, do you do a lot of sitting or standing?
I sit primarily 80% of the day, stand, walk around 20%.
Do you live at home with family?
Just my wife and dog.
Okay. Do you have any children?
No kids.
Okay. And do you use drugs?
No drugs.
Any tobacco use?
No tobacco.
And do you drink alcohol?
Yeah, I'd say about 2 or 3 beers a week.
A week?
Mm-hmm.
Okay. And so 2 to 3 beers a week, is that every week?
On an average, yeah, I'd say every week, 2 to 3.
And what type of alcohol do you drink? Besides just beer?
Yeah, I mean, just beer. If I'm at like a special event, maybe I'll have a whiskey and Coke. Other than that, just beer.
Okay. All right. And do you exercise?
I do. I'll go to the gym here and there, walk my dog. Overall, I'm just kind of an active person. So.
How often would you say you exercise?
I try at least 3 times a week.
Okay.
Mhm.
And do you do walking? Do you do any weightlifting?
Walking, weightlifting. To warm up for weights, I'll walk on the treadmill.
Okay. And do you feel safe at home?
Yes. Yeah.
Any history of abuse or neglect?
No.
Okay. So we've gone through why you're here because of
Mhm.
your headache. We talked about medications that you've taken, allergies that you have, your personal medical history, your family medical history, and your social history. Any questions or concerns that you have, we can discuss, but at this point we're done, and I will be back to do the rest of your interview, okay?
All right, thank you.
Thank you so much. Have a great day.
You too.